Did you know that almost 20 seniors will have been diagnosed with dementia by the time you're done watching this video? One every 66 seconds, that is. Here's the scary bit, though. What if aging isn't the cause? Next to your medication cabinet. These medicines are safe, common, and even necessary, you've been told. However, recent studies are raising concerns. 99% of seniors are unaware that at least one of their medications has the potential to reduce the size of important brain memory regions by more than 28% in less than a year. Take a moment to process that. What about the pharmaceutical sector? It has been aware of this for many years. However, they make billions of dollars marketing the same medications that may be hastening the cognitive deterioration of millions of elderly people. Indeed, within 2 years of use, one class of medications raised the risk of dementia in elders by 49%, according to a 2023 study published in Neurology and Aging Research. In this video, we'll list the top 9 drugs that cause dementia and quick memory loss, arranged from most often disregarded to mind-destroying. Third, although it is prescribed to millions for a harmless purpose, it can cause your brain's important memory regions to shrink. Furthermore, you most likely have no idea that it's doing it. Tell me what drugs you take on a daily basis in the comments section before we get started. And have you ever experienced unexpected forgetfulness or brain fog? Every remark is reviewed, and we provide tailored insights in our responses. Don't keep quiet. You might save your sanity from this. Without further ado, let's begin at number 9. Don't be fooled by its ranking. Almost every senior cabinet has one of them. Before you even realize it, it may be jumbling your thoughts. Benadryl or Diphenhydramine come in at number 9. Millions of people rely on Diphenhydramine, the pink pill, to help them go asleep, relieve allergies, or lessen the symptoms of a cold. You most likely have it on your nightstand right now, and it's inexpensive over the counter. Benadryl may be causing hippocampal disruption in your brain, even though you may believe you are only using it to improve your sleep or treat allergies. That's the area where new memories are stored. Benadryl belongs to a class of medications known as anticholinergics, which block the neurotransmitter acetylcholine. This molecule aids in maintaining alertness and creating new memories in the brain. Your brain becomes increasingly dependent on all of its available acetylcholine as you age, and the outcome can be disastrous if this medication messes with that process. A 2023 study published in the Journal of Geriatric Cognitive Health found that seniors who routinely took anticholinergic medications were 54% more likely to develop dementia than those who did not. How, therefore, can you safeguard your memory? First, stay away from anything that contains diphenhydramine, particularly if it is marketed as allergy relief, PM, or nighttime. Frequently, these are just disguised Benadryl. There are also more recent non-sedating alternatives to diphenhydramine for treating allergies, such as loratadine, also known as Claritin, which do not pass the blood-brain barrier and are far safer for elderly patients to use over an extended period of time. Never, suddenly, stop taking a medicine, but don't assume that over-the-counter medications are safe either. Next up is a medication that is frequently promoted as safe and easy on the stomach, but it can actually disrupt the nutrition your brain needs to remain healthy. Proton pump inhibitors come in at number 8. The drugs Nexium and Prilosec are members of the proton pump inhibitor, PPI class. These medications, which lower stomach acid, are frequently recommended to treat acid reflux, GERD, and heartburn. Since their symptoms reappear as soon as they stop taking them, many elderly people continue to take them for years or even decades. However, little attention is paid to how PPIs affect the absorption of vitamin B12, an essential nutrient that safeguards the brain and promotes emotional stability, memory, and focus. Regular PP users were 44% more likely to develop dementia than non-users, according to a 2016 study that looked at nearly 73,000 persons, 75 and older, and was published in JAMA Neurology. PPIs prevent the body from absorbing not only vitamin B12 but also calcium and magnesium, which are necessary for brain cell signaling and neural transmission, by excessively reducing stomach acid. In their absence, neurons have trouble firing effectively, leading to misfiring, disorientation, and memory loss that frequently resemble the early symptoms of Alzheimer's disease. However, the problem is more profound. Amyloid beta plaques are harmful proteins that impair brain function and are thought to be a major cause of Alzheimer's disease. It has also been demonstrated that PPIs raise the amount of these plaques in the brain. Fortunately, there are safer substitutes. Consult your doctor about utilizing H2 blockers, such as famotidine, which is marketed under the brand name Pepcid, to gradually go off a PPI if you take one on a daily basis. H2 blockers are less likely to impair cognition, yet they are not flawless. Additionally, a small amount of deglycyrrhizinated licorice, a natural substance that coats and calms the stomach lining, can be chewed to relieve symptoms without impairing cognitive function. The next drug is frequently used to manage the bladder, although it may be seriously impairing short-term memory and emotional equilibrium. 7th place. Drugs that regulate the bladder. Seniors who suffer from hyperactive bladders or urine incontinence are frequently administered doxybutynin, which is marketed under the brand name Ditropan. It appears to be a sensible option at first glance. The inconvenience or humiliation of frequent restroom breaks is something that nobody wants to endure. However, this drug functions by inhibiting acetylcholine, the same brain molecule that Benadryl interferes with. Furthermore, Oxybutynin directly affects memory areas in the hippocampus and more readily penetrates the blood-brain barrier than certain milder anticholinergics. For seniors, this makes it very risky, especially when used for extended periods of time. People over 65 who took powerful drugs like Oxybutynin for more than a year had a 49% increased risk of dementia, according to a 2019 study published in the BMJ. It's almost 1 out of 2. The fact that many seniors are never informed of the cognitive side effects is even more worrisome. They are not informed that it may hasten mental deterioration, only that it will aid with bladder control. The damage is frequently confused with aging. Patients reported experiencing dizziness, missing appointments, losing things, or suddenly finding it difficult to follow discussions. Seldom is it traced back to the drug until the harm has been done. Therefore, you don't have to continue taking Oxybutynin to maintain control if you've seen any mental alterations. They're not just your imagination. Thankfully, there are more recent drugs that function differently and have a much lower effect on memory, such as mirabegron, which is marketed under the brand name Myrbetriq. These medications are often seen as safer for elderly patients because they do not impede acetylcholine. The 6th is statins. Particularly for those over 60, statins are among the most commonly given medications worldwide. They are intended to decrease cholesterol and lower the risk of strokes and heart attacks. The two most popular ones are simvastatin and atorvastatin, which are marketed under the brands Lipitor and Zocor. However, this is where the issue begins. Cholesterol is a brain essential as well as a heart problem. Nearly 60% of the brain is composed of fat, and cholesterol is essential for the formation and upkeep of the myelin sheath, a protective layer that facilitates the smooth transmission of nerve messages. Reducing cholesterol drastically may potentially be depriving the brain of essential nutrients. Seniors over 70, who had been taking statins for more than 3 years were 26% more likely to experience mild cognitive impairment, and those taking high doses experienced significantly more pronounced reductions, according to a 2023 study published in Frontiers in Aging Neuroscience. The fact that some patients experienced sudden onset memory loss, where they were unable to remember names, recent conversations, or even known driving routes, is even more worrisome. It's critical to realize that not all statins have the same effects on the brain. Some, such as rosuvastatin and pravastatin, are thought to be less dangerous in terms of cognitive adverse effects, since they are less likely to penetrate the blood-brain barrier. It may be time to discuss a dose decrease or other course of action with your doctor if you have been on statins for years and you are experiencing fog, forgetfulness, or confusion. Avoid waiting until it's irreparable. You have a higher chance of safeguarding your intellect in the years to come if you act now. The fifth, some of the most commonly prescribed pharmaceuticals for anxiety and sleep issues are benzodiazepines, which include prescriptions like lorazepam or Ativan, diazepam or Valium, and alprazolam or Xanax. They function by increasing GABA, the neurotransmitter that calms the brain and lessens overstimulation. They appear to be lifesavers at first. They promote sleep, calm the mind, and reduce anxiety. However, these medications eventually turn into a trap, which is something quite different. Those who had used benzodiazepines for longer than 3 months had a 51% higher chance of acquiring Alzheimer's disease, according to a 2022 study that tracked over 8,000 seniors over a 6-year period and was published in the BMJ. Long-acting benzodiazepines, such as diazepam, which remain in the body longer and build up in adipose tissues, including the brain, increased the risk even further. Neural activity is slowed by a form of pharmacological sedation. Your brain stops learning as fast as a result. It becomes less adaptable, less effective, and more vulnerable to emotional sluggishness, memory lapses, and disorientation. Seniors using benzodiazepines frequently report feeling disoriented, or simply not themselves. Worst of all, withdrawal symptoms like anxiety, agitation, and insomnia can be rather bad when people try to stop using the drug, making it seem necessary when it's the cause of the issue. Here's what you need to do to fix this. Do not abruptly quit using a benzodiazepines if you've been using them for more than a few weeks. This could be harmful. Instead, reduce the dose gradually in close consultation with a physician. Alternatives that can help restore calm without impairing memory include cognitive behavioral therapy for anxiety and sleeplessness, or buspirem, a non-sedating anti-anxiety drug. Amitriptyline, often known as Elavil, is number 4. The older antidepressant amitriptyline, marketed under the brand name Elavil, is still frequently used today for pain, sleeplessness, and occasionally even migraines. Although it appears to be a multi-purpose miracle drug, it is really one of the strongest anticholinergic drugs now on the market, which means it inhibits the action of acetylcholine, a neurotransmitter that aids in memory formation, communication, and cognitive function. In fact, it blocks it so effectively that long-term usage is likely to have cognitive impacts rather than just potential. Researchers looked at nearly 3,400 participants 65 and older in a large 2015 study that was published in JAMA Internal Medicine. They discovered that people who took larger cumulative doses of anticholinergic drugs, such as amitriptyline, during a 10-year period, had a 54% higher risk of dementia. That is more than half the typical risk, not simply a small increase. The fact that many of these individuals were not informed that the medication could impair their memory is horrifying. Amitriptyline was frequently recommended to them for nerve pain or sleep problems. and they gradually started to notice effects including short-term memory loss, trouble finding words, and hazy attention. A large dosage is not necessary to create issues. Over the course of several years, even low-dose amitriptyline used nightly can cause a gradual, undetectable decline in brain function. The harm occurs in silence, with no early warning signs or symptoms, just a slow deterioration that mimics aging, but is actually drug-induced cognitive impairment. Consult a doctor about your options if you or a loved one is taking amitriptyline. Duloxetine and gabapentin are two medications that may provide relief from nerve pain without having the same anticholinergic side effects. Instead, low-dose doxepin, which has a considerably milder anticholinergic effect, or melatonin can be taken for sleep. Additionally, more recent antidepressants that are usually thought to be safer for the brain, such as escitalopram or sertraline, can be used to support mood. The third is Paxil or Paroxetine. One of the most often prescribed selective serotonin reuptake inhibitors, or SSRIs, for anxiety and depression is Paroxetine, which is marketed under the trade name Paxil. On the surface, it seems to be a contemporary antidepressant, which is meant to be kinder than the medications of the past. Here's what they don't tell you, though. Acetylcholine in the brain is interfered with by paroxetine, the only SSRI having strong anticholinergic effects. It differs significantly from its SSRI siblings, such as sertraline or escitalopram, because of that one element. Researchers looked at the cognitive characteristics of older patients taking various SSRIs in a comprehensive 2021 review that was published in Frontiers in Psychiatry. They discovered that paroxetine users had quantifiable decreases in verbal recall, short-term memory, and attention span over the first 12 months of using the medication. Additionally, compared to seniors using other antidepressants, those taking paroxetine had a 30% higher chance of exhibiting early indicators of cognitive decline. Ironically, despite being frequently given to calm mood, it eventually impairs mental clarity and emotional control. Here, the solution is simple, yet crucial. Seniors should not take paroxetine at all. Paroxetine has been added to the American Geriatric Society's list of possibly unsuitable drugs for older persons, known as the Beers Criteria List. If you're currently taking it, discuss with your doctor the possibility of switching to safer substitutes that don't have the same cognitive hazards, such as escitalopram or sertraline. Additionally, taking B vitamins, particularly B12 and B6, as supplements can assist naturally support mood. The second is antipsychotics. The fact that many seniors are unaware that they are taking an antipsychotic makes this one particularly concerning. Initially, medications such as olanzapine or Zyprexa, risperidone or Risperdal, and quetiapine or Seroquel were created to treat bipolar disorder and schizophrenia. However, they are now commonly prescribed off-label to older patients for behavioral changes linked to dementia, agitation, or sleep issues. Yes, these medications are used in hospitals and nursing homes for elderly patients who are just difficult to manage, disoriented, or restless, even though they are meant to treat serious mental illnesses. The repercussions are disastrous. Even if they had no past history of dementia, seniors who were administered antipsychotics for behavioral symptoms had a 71% higher chance of experiencing increasing cognitive loss within a year, according to a thorough study published in the Lancet Healthy Longevity in 2022, which monitored over 25,000 older persons. Even worse, these medications raise the risk of stroke, unexpected death, and extreme drowsiness, which can result in falls, hospitalization, or long-term institutionalization. It's a vicious mechanism. These drugs block dopamine, a neurotransmitter that is essential for memory processing and executive function, in addition to being connected to motivation and mood. The brain becomes slow and reactive when dopamine levels plummet. This explains why elderly people using antipsychotics frequently seem lifeless, emotionally flat, or zombified. Family members start to mourn someone who is still physically present as their personalities wane. The first step in fixing this scenario is to pose challenging questions. Ask the doctor why the prescription was recommended, and if it's really essential if you or a loved one is taking one of these drugs. Non-drug therapies such as establishing structured routines, lowering noise and overstimulation, treating pain or discomfort, and enhancing lighting and sleep hygiene can often be used to reduce behavioral symptoms. Lower doses taken for shorter periods of time can lessen risk when using medications that are absolutely necessary. However, rather than out of necessity, these medicines are typically utilized for convenience. Tragically, a lot of families aren't even informed about the effects of these medications. Without knowing that the cause is chemical rather than natural, they simply watch as their loved one deteriorates. Anticholinergic polypharmacy is the first. One of the main causes of drug-induced dementia in the elderly is this concealed risk, which hardly anyone discusses. You might think that one drug would be at the top of this list, but the most harmful prescription for seniors who are developing dementia quickly isn't a single tablet. Anticholinergic polypharmacy is the term for the stealthy, creeping side effect of concurrently taking several drugs with anticholinergic effects. Consider this situation. A senior takes Amitriptyline for pain, Oxybutynin for bladder problems, and Diphenhydramine for sleep. When combined, the cumulative anticholinergic burden increases dramatically, even if each one by itself could only result in minor memory issues. This is not merely a theoretical issue. Researchers studied nearly 280,000 older persons in a 2022 analysis that was published in Age and Aging. They discovered that those with the highest anticholinergic load had a 120% higher chance of getting dementia within 10 years. The risk is more than doubled. The worst part comes next. The majority of these elderly people were unaware that they were taking anticholinergic drugs at all. Your brain does not simply slow down when you block acetylcholine from several different directions at once. Decomposition sets in. Underuse causes synapses to shrink, neurons to wither, and the brain to go into a hypoactive condition that is similar to Alzheimer's. It doesn't take a miracle to fix this. A medication review is necessary. Request that your physician or pharmacist assess the anticholinergic load of all of your prescription medications, over-the-counter medications, and even supplements. The cumulative burden can be computed using professional software and internet resources. After being diagnosed, you can try to deprescribe, gradually taper off unwanted drugs, replace them with safer options, and adjust the chemistry of the brain. The most empowering aspect of the entire video is this. Dementia brought on by drugs is frequently curable. Many seniors recover their energy, lucidity, and memory function in a matter of weeks or months after the stress is removed. If you give it a chance, the brain can bounce back. Polypharmacy is the most hidden medical threat to the minds of our aging population because it is not only harmful, but also preventable. We'd like to hear from you now. Which of these drugs do you take at the moment? Since beginning a new drug, have you experienced any changes in your personality, forgetfulness, or brain fog? Would you be open to discussing a medication review with your doctor this week? Please leave your thoughts and experiences in the comments section below. We enjoy listening to them. Thank you for viewing.